My name is Carlos Hernandez, and I'm writing this 3 years after the COVID-19 pandemic killed my father Miguel at age 62, my uncle Roberto at age 58, and my grandmother Rosa at age 79 within a span of 5 weeks during the deadliest surge in 2020 to 2021, devastating our multi-generational Mexican-American household and revealing how COVID-19 wasn't just a virus but a revelation of systematic racism that killed Latino Americans at 3 times the rate of white Americans while we were simultaneously blamed for spreading disease, targeted by increased immigration enforcement justified by pandemic xenophobia, and forced to continue working as essential workers in meatpacking plants, agriculture, construction, and service industries without adequate protections because our labor was essential but our lives were expendable. At 37, I'm one of the survivors in a family and community that lost multiple members to a pandemic that America treated as tragic abstraction while the reality was concentrated death in communities of color that faced disproportionate health impacts because of pre-existing inequalities in healthcare access, housing conditions, employment options, and systematic disadvantages that made our vulnerability to COVID-19 predictable consequence of racism rather than unfortunate coincidence. The essential worker exploitation began in March 2020 when pandemic lockdown started, and I realized that my job at a meatpacking plant in rural Iowa meant I was classified as essential worker, who would be required to continue working despite COVID-19 risks because meat production was deemed critical infrastructure. While white-collar professionals transitioned to working from home, I and thousands of other Latino workers were expected to continue showing up to crowded plant facilities where social distancing was impossible, ventilation was poor, and the company initially provided no masks, no protective equipment, and no paid sick leave that would have allowed workers to stay home when symptomatic. The workplace COVID spread was rapid and devastating as meatpacking plants became COVID-19 hotspots with infection rates far exceeding community averages, but the company resisted shutting down production or implementing meaningful safety protocols because doing so would have reduced profitability and meat supply. Workers started getting sick by the dozens, then by the hundreds, bringing COVID home to their families and creating cascading infections in Latino communities where multi-generational households, crowded housing conditions, and lack of ability to isolate made disease transmission nearly inevitable once one family member was infected. The father's infection happened when I brought COVID home from the meatpacking plant despite my desperate attempts to avoid transmitting the virus, changing clothes in the garage, showering immediately upon arriving home, wearing masks inside our house, and trying to maintain distance from my father who had diabetes and heart disease that made him high risk. But our small house made true isolation impossible, and within a week of my positive test my father developed symptoms that rapidly progressed from mild to severe, requiring hospitalization that revealed how unprepared our rural hospital was for pandemic surge. The healthcare disparities became devastatingly apparent when my father arrived at the emergency room and faced language barriers because the hospital had no Spanish-speaking staff and interpretation services were inconsistent, creating dangerous communication gaps about his symptoms, medical history, and treatment preferences. The hospital was overwhelmed with COVID patients, lacked sufficient ventilators and ICU beds, and my father received care that was clearly inferior to what white patients with better insurance were receiving in urban medical centers with more resources. The death vigil happened outside the hospital because COVID protocols prohibited family from being with dying patients, so I stood in the parking lot on my phone saying goodbye to my father who died alone in an ICU without his family's presence, without his preferred language being spoken, and without the dignity of dying surrounded by loved ones. The trauma of not being able to hold my father's hand as he died, of having his final moments be isolated and frightening, added profound suffering to the already devastating grief of losing him. The funeral restrictions meant we couldn't have a traditional funeral with our extended family, community, and the cultural practices that would have honored my father's life and provided collective grieving space. The pandemic regulations limited gatherings, making the mourning process feel incomplete and denying us the rituals that would have helped process the loss while connecting us to our cultural traditions and community support systems. The economic devastation followed immediately as my father had been the primary breadwinner whose income supported our multi-generational household, including my mother, my grandmother, and my younger siblings who were still in school. His death meant not just emotional loss but immediate economic crisis, as we lost his income while facing burial expenses, medical bills from his hospitalization that insurance didn't fully cover, and ongoing household expenses that now had to be managed on my income alone, which was insufficient for supporting the entire family. The uncle's infection happened while we were still mourning my father, as my uncle Roberto, who worked in construction, also contracted COVID-19 despite being vaccinated because the vaccine was less effective against the variant circulating at that time and because his job site had minimal safety protocols with workers sharing vehicles, eating together, and working in close proximity. His infection progressed even more rapidly than my father's, and within 10 days of his first symptoms he was dead, leaving behind a wife and 3 children who lost their father and primary income source. The grandmother's death was the most devastating because she had survived so much immigration from Mexico in her 20s, decades of agricultural labor, raising 6 children while working in fields, and finally achieving some stability in her old age with her children supporting her. COVID-19 killed her within days of her first symptoms, her age and underlying health conditions making her especially vulnerable to a virus that the United States had failed to contain because protecting vulnerable populations would have required prioritizing lives over economy. The community mass death was all around us as our Mexican-American community in rural Iowa experienced catastrophic losses that received minimal national attention despite death rates in our zip code exceeding rates in many major cities. The meatpacking plant where I worked became known as a COVID hotspot, with over 60% of workers infected and dozens dead along with their family members who caught the virus from them. Our community's small Catholic church couldn't keep up with funerals. The Spanish-language section of the local cemetery filled rapidly with recent graves, and everyone knew multiple families who had lost members. The employer accountability absence was infuriating as the meatpacking company faced no consequences for the working conditions that had turned their facilities into COVID superspreader sites, for their initial refusal to provide protective equipment, for their pressure on sick workers to continue working rather than staying home, or for their negligence that had killed dozens of workers and their family members. Federal regulators issued small fines that were meaningless to a corporation that had maintained profits throughout the pandemic by treating workers as expendable. The healthcare access barriers that existed before COVID-19 became deadly during the pandemic as our community's high rates of uninsured and underinsured people meant that many delayed seeking care because of cost concerns, while fear of immigration enforcement kept undocumented community members from accessing medical services even when severely ill. The lack of preventive healthcare meant higher rates of underlying conditions like diabetes and hypertension that made COVID-19 more deadly, creating a direct line between pre-pandemic health inequities and pandemic death rates. The housing conditions that characterized our community's living situations, multi-generational households in small homes, multiple families sharing apartments, workers living in crowded trailers, made isolation impossible and disease transmission nearly inevitable once COVID entered a household. The same housing conditions that resulted from low wages and housing discrimination became transmission vectors that killed families, revealing how every inequality became deadly during pandemic. The racist scapegoating intensified even as our community was dying from COVID-19, with political rhetoric blaming immigrants and Latinos for spreading disease while ignoring that we were being forced to work as essential workers in conditions that guaranteed transmission. The racist framing positioned us as vectors of disease rather than recognizing us as victims of systematic negligence and exploitation that made us disproportionately vulnerable to a virus that employers, policymakers, and society treated as less concerning when it was killing brown people. The ICE enforcement escalation happened during the pandemic as immigration officials justified increased raids and deportations by claiming they were protecting public health by removing disease-spreading immigrants, despite no evidence that undocumented immigrants had higher COVID rates than citizens and despite the fact that immigration enforcement actually worsened public health by making undocumented people afraid to seek testing or treatment. Several families in our community were torn apart by deportations during the pandemic, with breadwinners removed while their families were still grieving COVID deaths. The vaccination disparities emerged when vaccines became available but weren't initially distributed equitably to communities of color or essential workers who faced highest risk. Our rural area received limited vaccine allocation, The predominantly Latino essential workers weren't prioritized despite being in high-risk occupations, and language barriers, transportation challenges, and documentation concerns created additional obstacles to vaccination for community members who desperately wanted protection but couldn't easily access it. The long COVID burden has affected multiple survivors in our community who didn't die from acute infection but developed chronic symptoms that have prevented them from working or that have reduced their earning capacity and quality of life. The long-term health impacts are creating ongoing economic strain in families that are still recovering from losing breadwinners to COVID deaths, and the medical costs of treating long COVID are overwhelming families that already faced medical debt from acute COVID hospitalizations. The community organizing response began when it became clear that official pandemic response wasn't addressing our community's needs or even acknowledging our disproportionate losses. We organized mutual aid networks to support families that had lost breadwinners, created Spanish-language information campaigns about COVID prevention and treatment when official information wasn't accessible, advocated for workplace protections that employers were refusing to implement voluntarily, and documented the COVID deaths in our community to create visibility for losses that national media was ignoring. The memorial project that emerged from our organizing involved creating a community memorial honoring everyone from our area who had died from COVID-19, with special emphasis on the essential workers who had been killed by working conditions that corporations and policymakers had refused to make safe. The memorial includes photos, names, and brief biographies of the deceased, creating permanent record of lives that official statistics reduce to numbers without acknowledging the families, communities, and humanity of people who died from preventable disease. The policy advocacy work includes pushing for permanent protections for essential workers, including mandatory paid sick leave, workplace safety enforcement with meaningful penalties for violations, and occupational health standards that prioritize worker safety over corporate profits. We're also advocating for healthcare reforms that would address the disparities that made COVID-19 so deadly in our community, including expanded access to primary care, language-accessible health services, and policies addressing social determinants of health like housing and income that created the vulnerabilities that the pandemic exploited. The class action lawsuit against the meatpacking company is ongoing, with dozens of families joining together to hold the company accountable for working conditions that killed their family members. The company is fighting the lawsuit vigorously while also lobbying for legal immunity from pandemic-related liability, but we're determined to achieve some measure of accountability even though no amount of money can compensate for the lives we lost. The grief counseling that helped me process the compound losses of losing 3 family members within weeks was provided through a community mental health organization that received emergency pandemic funding to address the mental health crisis in communities that had experienced mass death. The counseling was culturally appropriate and Spanish language, addressing not just individual grief but collective trauma and the specific challenges of grieving multiple losses simultaneously while also dealing with economic strain and ongoing pandemic stress. Today, I continue working at the meatpacking plant because I need the income to support my mother and younger siblings after losing my father's income, but the plant is a constant reminder of how my father died and how corporations value Latino lives so little that they were willing to let us die rather than reduce profits by implementing safety measures. I'm also involved in ongoing community organizing to ensure that the disproportionate COVID deaths in Latino communities aren't forgotten and that systematic changes address the inequalities that made the pandemic so deadly for our community. The intergenerational impact includes my younger siblings growing up without their father and uncle, my nieces and nephews traumatized by losing their father and having seen grandparents die, and an entire generation of children in our community who experienced death on a scale that will affect them psychologically for their entire lives. The trauma isn't just about individual losses but about the collective experience of community devastation that revealed how little our lives mattered to the systems and institutions that were supposed to protect everyone. Key resources and solutions that made the difference. Community mutual aid networks provide material support for families that lost breadwinners and income during pandemic while experiencing compounding crises. Culturally appropriate grief counseling addresses both individual and collective trauma from mass death in communities disproportionately affected by COVID-19. Community organizing for workplace protections holds employers accountable and advocates for permanent safety standards protecting essential workers. Policy advocacy pushes for healthcare reforms addressing disparities in access, quality, and social determinants that made pandemic deadly for communities of color. Memorial projects create visibility for lives lost and ensure that disproportionate deaths in communities of color aren't forgotten or reduced to statistics. Class action litigation holds corporations accountable for working conditions that killed employees and their family members through negligence and profit prioritization. Spanish-language health information and vaccination assistance addresses language barriers and access challenges that worsened pandemic impacts in Latino communities. Documentation of disparate impacts creates evidence for advocacy about how systematic inequalities created predictable patterns of disproportionate death during pandemic. Today, when people talk about moving past COVID-19 and returning to normal, I explain that my family will never return to normal because normal is dead and buried. My father, my uncle, my grandmother killed by a virus that was only as deadly as it was in our community because of systematic racism that made us essential but expendable, that forced us to work without protections, that denied us healthcare access, and that crowded us into housing conditions that guaranteed transmission. The real pandemic in communities of color wasn't just COVID-19 but the revelation that our lives have never mattered enough to protect, and that the same inequalities that made us vulnerable to pandemic death continue to operate now that the acute crisis has passed.